All right. Thanks, the Dr. Director Shi's the introduction. And so now we are keep forward to our keynote speech today. So I would like to announce. So today, due to the previous our schedule mildly delay, so all the schedule will be probably postponed for probably 10 minutes. So this section will continue up to the for Taiwan time before 14:10. No, 16, yeah, 16:10, right? Okay, so now, I'm going to introduce today's keynote speech the speaker. So this keynote speech is arranged by Professor Tan, and today our speaker is Dr. Tan. So I think that Dr. Tan is already online. Hello, Dr. Tan.
Yes,
can you hear me?
Hi, Professor.
So today, because we invite Dr. Tan to give us another time the keynote speech about the COVID-19. The topic is the COVID-19 and approach from the psychiatry and the society in Vietnam. As you know, the COVID-19 has been continue for near years, and it is a pandemic. So we know that Vietnam has been doing a very nice job to on the handle and even prevention of the COVID-19. So that's why we are very happy to have the Dr. Tan to give us again this kind of the keynote speech. So welcome the Dr. Tan. So please, okay, let's welcome the Dr. Tan. Thank you.
Yeah, thank you very much for inviting me for present again. Hi everyone, good afternoon. Today I am very glad to be here to present our research or our review about COVID-19 in Vietnam. As you know, COVID-19 is I can say that in the crisis globally, not and in Vietnam at the moment, the COVID-19 has coming as the boom. And today I will present again my presentation. Okay. So my presentation is a result of a group research led by Professor Nguyễn Văn Tuấn, but today he is busy, so I am nominated to present. And these presentations are the updated versions presented one on July 11, 2020. So our presentation have two parts. The first one is COVID-19 situation in consequences in Vietnam. And the second is action to identify and address mental health issues from psychiatric and social aspect in Vietnam. The first one, so by July 11, 2020, you can look at this data. In the world, we have more than 12 and a half positive cases COVID-19, but in Vietnam we only have 370 cases, and remarkably, just no one died by COVID-19. And most of the case is in the north of Vietnam, in Hanoi here, and in Ho Chi Minh here, and they randomly in Da Nang. So how Vietnam combats against the COVID-19 pandemics? We act very in active action at the very and early stage at all levels, under the controls and the supervise of the party of the government, the national COVID-19 committees. All the ministry works together and get involved in the action. The Ministry of Health and Health System, they conduct a lot of epidemiological activities to prevent the control of COVID-19, such as detection, confirmation of cases and suspect, close contact, isolation, clinical care to positive cases in hospital. And the Ministry of Foreign Affairs, we close borders with China, Laos, and Cambodia, and health checks for all entering Vietnam. Ministry of Transportation with the flights banned to and from Vietnam, repatriation from Wuhan and Europe to Vietnam in February and March. From April the 16th, suspension of public transport, cancellation of most domestic flights, and the Ministry of Defense we provide of local isolation points for people returned from abroad to Vietnam. With the Ministry of Education and Training and the Education Network, we closed all schools and introducing our online learning. And with the support from the Ministry of Science and Technologies, we update the information on COVID-19 in the mass media trace cases using big data and technologies. Here's the figures describe hours COVID-19 in Vietnam before the July 11. You can look at here. We have exactly 2 waves of COVID-19. In the January, the first case from Wuhan were reported, and after 2 weeks, we have 16 cases positive, and we control. And the second wave is in the earliest of March. We need the numbers. Numbers are 17th. She came back from the European country, and after that, the number of cases increased day by day. And at that time, at the second wave, we tracked and health screening for all passengers on the same flight. And in the middle of March, the health declaration nationwide, and in the earliest of April, the government applied social distancing nationwide. And at the end of April, I mean that's in the one month after, we declared successful in controlling COVID-19. But the bad news has come. On Saturday, July the 25th, the first positive cases in communities after 99 days of COVID-19 free. This case marked the first wave of disease in Vietnam. Here's Da Nang, where we reported the cases, and just in 1 week, nearly 100,000 individuals moved out of Da Nang to nationwide. And at the moment, this is the data this morning. In the world, we have more than 22 million, nearly 23 million cases. And in Vietnam, at the moment, we have 1,007 is higher 3 times in comparison with 1 month ago. And very bad news that we have 25 cases. Patient was died by COVID-19. Until now, Vietnam has partly succeeded in controlling COVID-19 crisis, but Vietnam does not stand at the outside of the world. The COVID-19 have the direct and indirect influence into the societies. For example, the social change in economy, markets, education, isolation, and quarantine. The COVID-19 affect in individuals with COVID-19 with the physical disorders, pre-existing psychiatric disorder, and we really scare that the medical health system in Vietnam can be disrupted if the numbers of the COVID-19 patients are booming. And you know that with this situation, we live in an environment that have the prolonged stresses in an insecure environment and uncertainties. I mean that insecure environment that you can suspect everyone around you that they have the COVID-19 scare or uncertainty. I mean that suddenly you receive the information your use or your friend, your relative was diagnosed with the COVID-19. And with the effect, the mental health issues will appear, I think, as a result. These are the mental health issues not only in the whole population, but I want to mention in the vulnerable populations, especially the healthcare and other frontline workers, the informal or self-employed workers, the women, children, and elderly, and people with pre-existing mental or physical health condition or disabilities. The consequences of COVID-19 on economy. The government's statistics office reported that the GDP's growth in first quarter in 2020 is just only 3.82%, which has been the lowest since 2010. The tourism, the business, aviation services are among the most affected industry in Vietnam. And the COVID-19 had affected nearly 5 million workers and almost 85% of enterprises in Vietnam as at the middle of April. And nearly 13% of them have lost job. Nearly 30% are taking turns to work, and nearly 60% have been temporarily out of work. And here are the pictures of the series of shops on the very crowded street in Hanoi. But at the moment, they're all closed. And on the market, I think in the countries in the same in Vietnam, we experience the panic buying. I mean that it's increased the demand for masks and antiseptic waters. Some basic necessities were also priced. So the governments take action. The market management force and financial inspectors increased to intensify checking and strictly handling cases of price increase affecting consumer interest. These are the pictures that describe the panic buying in Vietnam in a supermarket. And on education, with the public school, the students have a long period. I think that is the longest period that they have to absent from school from the mid-January to early May. They have different opinions and conflicts around whether students should continue to be absent or not. And the Ministry of Education and Training, they really have a headache to decide to finish the school years 2 months later than usual. And I think at the time is the high pressures to apply the alternative teaching methods with the teachers and the students. And a lot of students have suffered from the fears of low academic performance because a lot of them are prepared for the exam to university or college. With the private preschools, they have more difficult in comparisons with the public school. The private preschools cannot pay for ground support, salaries paid to teachers, and many teachers lost their job, switched job. Some private kindergartens were at risk of having to cut teachers with some school liquidate teaching equipment. Here are the pictures of the student in the mountainous areas in Vietnam. They have to wear the paper-made mask in the time that they lack of the mask. And on the traveling, and you know that all the passengers entering Vietnam will be put in quarantine for 14 days. In the efforts to stop the spread of the virus, Vietnamese Ministry of Health has ordered all Vietnamese and foreigners in the country to wear face masks in the public places. Those found not wearing masks or not disposing of masks properly will be fined. And I want to mention about the consequences of COVID-19 on healthcare workers. This is like my hospitals where I work at the moment. On March 29th, 2020, Hanoi locked down the Bạch Mai hospital after a COVID-19 infection. This hospital is the biggest hospital of Vietnam. And also, at that time, like my hospital was considered the biggest and the most complex hotbed of the COVID-19 until June 2020. But at the moment, the Da Nang City's hospital and Da Nang cities in the middle central Vietnam are the hotbed of COVID-19. Most of the patients with severe physical diseases, the kidneys, the livers, and heart failures, more than 10 medical staff are reported positive with SARS-CoV-2. And most of the medical staff were isolated at the hospital. And some of those that some of my colleagues in my hospital at that time and at the moment in Da Nang City, they report I live in fears, and my family live in discrimination, stigma from neighborhoods. The teachers do not allow my children to go to the kindergartens because I work in hospital. Although my tests were all negative, I cannot find someone to take care of my children. And on the COVID-19 patient, here's the pictures of the patient, the COVID-19 patient, the number 17, who was considered the beginnings of the second phase in Vietnam. She reported that she suffers from the psychological disturbance, anxieties, the symptom of PTSD, fear of death, sleep disturbance. But not only that, that she also report she experienced the cyberbullying, the criticisms, stigma, and discrimination from internet. And by own factors, the COVID-19 had a significant consequence, significant impacts on the mental health. Here's some result of some research in this issue, mental health. The worldwide result with the non-clinical population, I mean the general population, at the moment, most the studies were conducted in China. Most of the Chinese people from 7% to more than 50% experience psychological distress during the initial stage of the COVID-19 outbreak. The levels of stress, anxiety, and depression range from mild to moderate to severe. And in a student population, the rate of mild, moderate, and severe anxieties was 21%, 2.9, 2.7%, and 0.9% respectively. And female genders and young adults experience a major negative impact. In the healthcare population, healthcare worker population, this population was at the particular risk of negative psychological impacts during the pandemics, especially if they were frontline workers. They exposed to a high levels of stressful and traumatic events and express substantial negative mental health outcomes, including stress-related symptoms, depression, anxiety, and insomnia. And the research, announced that the depression rate was nearly 50%. Anxiety rates range from 20% to 44%, and the insomnia and stress rate was also high. And in the patient with affected by COVID-19, very surprising that nearly 100% of the patients which are clinical stable reported that they had a significant post-traumatic stress symptom prior to discharge, likely leading to lower quality of life and impaired working performance. And nearly 50% of people diagnosed with COVID-19 have the depressive symptom. More than 55% had anxiety, and almost 70% had psychotic symptoms. Among these patients, 9%, 50%, and 21% were severe cases, respectively. And at the moment, we only have 2 papers mentioned about the patient with the pre-existing mental disorders, and 37 patients with eating disorder reported that they reported worsening in their symptoms, and more than 50 reported additional anxiety symptoms. But in another study, is report 0.9% of patients with pre-existing psychiatric disorder worsening their symptom. But this paper did not mention what kind of the pre-existing diagnosis. So, so I've just mentioned some research about the influence of COVID-19 on the mental health in the worldwide. But so come back to Vietnam. We need the action to identify and address the mental health issues from the psychiatric and social aspect in Vietnam. So we have the question: the mental health and psychiatric disorder among multi-groups in Vietnam in COVID-19, like in general population, in the healthcare worker, in the patient with COVID-19, and especially in the patient with pre-existing psychiatric disorder. And the patterns and determinants of psychiatric disturbances at different stages of the COVID-19 crisis, at the initial state and after that. And the question is how to effectively support patient and society in the COVID-19 context. The current research in Vietnam, until today, only one research has reported regarding mental health issues related to COVID-19. This result, they study in the people with the suspected COVID-19 symptoms had that the results indicate that this population had a higher depression and lower health-related quality of life score, and the risk factors is older age, the comorbidities like physical health, lower education attainments, and lower physical activities. And the patient with health literacies were a positive factors for improving depression and health-related quality of life. And our group in the Hanoi Medical Universities and my hospital, we also have research focused on the psychological and behavioral response to COVID-19. This is a cross-sectional study among the overseas student population. We decided to research on this population because, as I mentioned before, this group is the vulnerable population. And our research with the objective that to evaluate the psychological and behavioral response change due to the COVID-19. With the method, this is the cross-sectional studies were conducted from June the 15th to July the 6th. An online surveys we use Google Form were used along with the snowball technique sampling on the PhD RIG's group. And we also use some scale like the fear of COVID-19 scale, the COVID stress scales, the impact of event scale, in the DAS21 items. And this research were approved by Hanoi Medical University. And here is the result. This socio-demographics and social status characteristic, nearly 70% were female, and most of them are early adults. Just only 20% are adolescent, and most the major proportion are the graduate levels and bachelor undergraduate level. Most of the participants, is now studying in the Americas, Canada, some in European countries like France, Germany, UK, and about the social status, nearly 60% are overseas at the moment and not intend to fly back to Vietnam, and just 3.5% is in quarantine zones in Vietnam. But this research was conducted 2 months ago. And about the fears of COVID-19 by age group, social status, and studying area. You can look at that. with the adolescent, they have the highest score of the fears of COVID-19. And people at the moment in quarantines, joined in Vietnam, and who are overseas and waiting to fly back in Vietnam have the highest score of the COVID fear of COVID-19. And in the nation, the Americans like the USA and Canada's, they have the highest level because until now, American still in the most complex COVID-19 in the world. And the East Asia is the highest because at that time, the Koreans, the Japanese saw the second wave of the COVID-19 coming back. And the depression, anxiety, stress, and PTSD, you can look at that. The prevalence of the depressive symptom is really high, and anxieties and stress and PTSD are the same. Especially the adolescents, they have the highest prevalence of depression, anxieties, stress, PTSD. I think that this is we can easily understand for this data because this group are more vulnerable and they have lack of the coping skill and knowledge how to cope with the COVID-19. And the highest levels of depression, anxiety, stress, PTSD is also highest in the overseas and waiting to fly back to Vietnam population.
请问是
And here's the result. Like I mentioned before, the fears of COVID-19 is associated with the depression, anxiety, stress, and PTSD. And the student in American and East Asian experience the highest levels of psychological symptoms. And this is a small part of our result. And we have the conclusion that we have a high risk of psychological symptoms among the overseas students. And the adolescents living in America be waiting to fly back to Vietnam are the factor associated with the psychological symptoms. So the challenge at the moment in Vietnam is that we are lack of awareness about the mental health problem. We lack of the evidence-based medicine. We have lack of the resources. And we suggest some possible solution. We need to increase the awareness on the mental health, especially in the traumatic crisis context. We can reduce the stigma towards psychiatric disorders and increasing research. Here's a diagram describe about the mental health in Vietnam. This red triangle here, about nearly 15% the patient have the mental health that are recognized in Vietnam. But the problem is that we do not know about the exact numbers, the exact data about the individuals with vulnerabilities and hidden psychiatric disorder. And as a psychiatrist, we have the responsibility to raise the social awareness of the psychiatric disturbance and the high risk population in Vietnam. To solve this, we use the education through the mass communication. We consult to the policymakers and stakeholders. And this is the first time the Bạch Mai Hospital working with the Ministry of Health, we promulgate a professional document, the guidelines for mental health care in COVID-19 pandemics. This guidelines is the result of the effort of a lot of specialists and psychiatrists in the Bạch Mai Hospital and the Ministry of Health. Because, as I said before, the Bạch Mai Hospital consult directly to the Ministry of Health, so we can apply this guideline throughout Vietnam. And the mental health in Vietnam at the moment, the mental health care staff, to some extent, still have the stigma from other specialties, but at the moment, they need they need to recognize themselves are undetectable from general healthcare in traumatic event. Uh, they need early recognize the psychological issues in those with severe physical diseases. In the traumatic events, we need to raise awareness about the consequences of prolonged stress in insecurities and uncertainty. We need to ensure the accessibility of the mental health services via available platform and promote to develop the sustainable resources. And we need to protect standards of care and human rights in places of detention, psychiatric hospital, and long-term care facilities through shared learning. This is the first time a special task force was nominated by the Ministry of Health to aid the medical staff in 3 hospitals in Da Nang. Here's my colleague, Dr. Bùi Văn San, a special psychiatrist. He is consult with medical staff in Da Nang Hospital. And here's psychiatrist Vũ Xuân Tùng, working with this mental health, with the healthcare staff here. And during the break, we instruct everyone to sit comfortably, suggesting visitors to think about good things like playing with their wife and children or remembering the sports game they love. At the time, the stress will lessen. As you can recognize that there is a type of mindfulness we use to we apply on with the mental health care staff, and I think and the result is positive. And this is the image of Dr. Nguyễn Trường Sơn. He is the Deputy Minister of the Health. He stressed the mental health stabilities is especially important with those who work in medical settings all day. So we do not want to see our doctors, nurses to be exhausted by stress. And to increase the social awareness, the government decided to increase the TV program related to mental health and COVID-19, and we increase the telehealth activities based on the mobile phone, the internet platform. And also the first time, the Department of Psychiatry of the Hanoi Medical University and Ministry of Health launched the project named Communications and Awareness on Mental Health in Communities. And this is the this is a live sorry this is a live TV program that we have more than 1.5 million views. I think this is really successful. And here's the pictures describe the mental health care system in Vietnam. There are four institutions work directly under the control of the Ministry of Health: the National Institute of Forensic Psychiatry, the National Institute of Mental Health, where I work at the moment, the National Psychiatric Hospital number 1 in the north of Vietnam, and the National Psychiatric Hospital number 2 in the south of Vietnam. And we also have the Province Psychiatric Hospital and Center for Disease Control and Prevention. And our mental health care services lie throughout the center to the communities. But at the moment, the psychiatrists we just only have 0.35 per 100,000 citizens. I think this number is really low in comparison with countries like Singapore or Thailand or Malaysia or Indonesia and in Taiwan. So coming to the conclusion, after my presentation, I want to gives the idea that we need the strategies for prevention and dealing with the mental health issue. These strategies should be clearly defined at each stage of the traumatic events by multi-dimensional approaches. And mental health, especially mental health worker, needs and they have to recognize as a critical part of the healthy society. And as I think all of you know the United Nations, the 2030 Agendas for Sustainable Development. I hope that our words today and our conference today contributes to the goal of this agenda in the number 3, good health and the well-being and the partnership for goals. And thank you for your attention. And if you have any question, please do not hesitate to ask me. Thank you.
So Dr. Tan, so excellent speech. So is anyone has a question to raise for Dr. Tan? So okay, let me ask you a question, Dr. Tan.
Yes. Okay.
So since since the COVID-19 it seems to have the higher risk to probably relapse again. So is there any comment on this further management? I mean, in any way, especially on the mental health. And so based on your expertise, so is there any comment for us?
I think
Yes.
as the secretaries, we at the moment we need. I think the first there are I think there's two problems, two issues that how to reduce the new onset of the patient with psychiatric disorder and how to help the patient with the pre-existing of psychiatric disorder. And as I mentioned, in the COVID-19, when at the moment they is come back uh, strongly, and with the patient have the psychiatric disorder, we also give them the advice to follow up the treatment regimens at the locals or the centers. But they need to follow the indication, the instruction of the Ministry of Health, how to protect them not to expose to the COVID-19. But with the general population or the medical healthcare staff on the patient with COVID-19 in the next time, we need to conduct more research in our context. Like I think the first research will be conducted with the patient with COVID-19, and the second in the uh, healthcare workers. And after that, these results will be given to the Ministry of Health to show that they need to take action like providing them available platform via the internet or mobile phone to help them to recognize the early symptoms like anxieties, insomnia, and how to contact with the professions to deal with their problems, I think.
Okay, thank you. So is there any further question for the Dr. Tang? Okay. Okay. So, Dr. Tan, are you there?
Yes, I'm here.
Yes, I hear from the Dr. Liu, and he mentioned about you also have the uh, supervisor two student on this similar project. So, would you like to invite them for give us about their comment also?
Yes. At the moment, we have two students here. They are in high school student, which one of them is coming from the Americas, and one of them is living in the, Vietnam. And I want to introduce Miss Nguyễn Khánh Vi. She's a student now live and just come back to Vietnam from the America, and she's a person's experience very experience the significantly about the stress uh, in uh, in America and the COVID-19.
So,
Uh, Hi.
does she has anything would like to share with us?
Yes.
Or,
I,
yes.
I, I, maybe she's out here.
So is she online? So well. So
She's still online.
okay. So during this time, so is anyone has a further question for the Dr. Tan about related to the COVID-19 and the experience in Vietnam? So as we know, so COVID-19 it seems to is not finished yet. So in the whole world, in many countries, so every government try to um, management manage it as good as possible. So based on the Dr. Tan's their excellent experience, so remind us. So in spite of the physical illness such as the vaccine or further critical management, so we need to focus on the psychological impact because I believe this impact is global and it affect many sides in our life. So we also, if anyone doesn't have any further questions, so I would like to close this keynote speech. And thank you, Dr. Tan's excellent speech. So thank you.
Yeah, thank you very much.
All right.
Thank you very much.
Okay, thank you.